Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome Dr. Gretchen Hawley, influencer and the founder of the MSing Link. Welcome, Dr. Gretchen. How are you today?
I'm good. Thank you so much for having me.
Oh, it's our pleasure. It's our pleasure. Thanks for taking time out. Now, you're also the founder of the MSing Link, and that's MSing Link is how it's pronounced, but it's spelled MSing, then Link. Let's start off a little bit with your unique credentials that many people don't even know exist, and a little bit about who you are and how you're helping people.
Absolutely. So I'm a physical therapist. Lots of people know that we exist. But what a lot of people don't know is that you can specialize in very specific niches. And so one broader niche might be a neuro certified specialist where they treat all neuro populations, people diagnosed with neurodiagnoses. But multiple sclerosis is a very specific neuromuscular disease that you can specialize in. And so that's what I specialize in. And I find it extremely rewarding because when you have MS, a lot of the times the goals that you're working towards are things that a lot of us take for granted. And it's also a progressive disease and a chronic disease. And so it's easy to feel like you might not be able to improve your strength, your balance, your walking, but you actually can when you implement the right type of exercise and physical therapy. And so I often see people going from this mindset of, I'll give it a try, but I don't think it's going to really help, to actually seeing improvements in their day-to-day life, which is really cool.
Now, we met via social media. And, you have a great following there, and you do specialize mostly in MS, correct?
Yes.
Explain how neuroplasticity plays a role in, MS and these other conditions, because I know for us, we talk about neuroplasticity a lot with dementia and, reshaping the brain, but it's not just a dementia issue. It's the whole brain. I would love for you to speak on that.
Yeah. And the cool thing about neuroplasticity is it's not just the brain. It's not just strengthening, which is what I mostly use it for. It's everything. It's even our mindset. Every habit that we have, every thought pattern that we have has a neural pathway that makes us do those things and think those things. So we can truly rewire the way that our entire body works. So the way that I use neuroplasticity is by strengthening or rewiring the neural pathways that are already there. So if someone doesn't know what neuroplasticity is, or you want a little recap, the way that I like to think of it is, if you can move a muscle, if I were to say, lift your leg, and you can lift your leg, even if it's harder, or maybe it doesn't lift as high as it used to, or as high as the other side, if you have some movement, any movement, that means that the neural pathway from your brain all the way down to that muscle is working. It's there. It might not be as strong as you want it to be, but it's there. So the one way that neuroplasticity can work is by strengthening that neural pathway that already exists. It's just not strong enough yet. But the other way that neuroplasticity works, and this is the one that's really powerful, is that if I were to say, lift your leg, and you cannot lift your leg, you're trying everything in your power to lift your leg and it doesn't lift. That means that your neural pathway, in the case of MS, has been demyelinated. So it's just to a point where it's not working at all. But the good news is that through neuroplasticity, your brain can find a new neural pathway. So even if you have no strength at all, you have the potential to improve that strength by finding a new neural pathway. And there's different strategies and exercises that you do for that, but that's the power of implementing neuroplasticity-based exercises for strengthening and walking and function just throughout our day. Even things like getting dressed, getting in and out of the shower, in and out of a car, things like that.
Is it fair to make a comparison to teaching children how to walk with the neuroplasticity?
Absolutely.
Yeah.
Yeah. And that's the thing. Neuroplasticity happens in all of us, and we mostly see it and witness it visually in toddlers and babies who are learning to walk, learning to do things for the first time. Neuroplasticity typically, especially in adults, is not something that you can see. It's not something you can feel or hear. And so it really requires a lot of consistency, because it really takes doing something over and over and over again, like babies and toddlers falling, or they're trying to learn something, they get it wrong a million times before they're actually good at it. It's the same thing for adults, but in adults it does take a little bit longer too than in children.
Now, you specialize in treating people with multiple sclerosis. How does MS differ from other conditions? And I want to follow that up after you give that answer with what drew you to MS as being like what you're known for in your specialty.
Yeah, I'll start with that question first. So, what drew me to MS is, as a physical therapist, I was working in an outpatient orthopedic clinic. And that is the type of PT clinic that you would go to if you have any type of pain, back pain, neck pain, shoulder pain, or an injury. Maybe it's a sprained knee, sprained ankle, or surgery. Maybe you had back surgery, hip surgery, knee surgery, you name it. So a lot of orthopedic conditions. However, while I was treating a lot of patients with orthopedic conditions, I was fortunate enough to treat two people with multiple sclerosis around the same time. And what I noticed very clearly right away is that both of these patients were about the same age, and they had the same type of MS, because there's a few different types, but their symptoms were drastically different. And not only that, but each individual, every time they came to see me, their symptoms were different, whether it was different intensity or maybe just non-existent one day, but a different symptom was there. And as a physical therapist, my favorite part about my job is brainstorming and being creative and trying to find unique ways for exercise to work for anyone and everyone. And so I found that with the MS population, that is required for every individual. So I just loved that. But I also realized early on that multiple sclerosis was a different breed. It was not orthopedic exercises that were going to be helping. It's so different. And so that's when I decided to become an MS specialist, because I really felt like I needed to know everything about MS in order to best help those patients that I was working with. So that's kind of why I loved it and how I got started. And also leads perfectly into your other question, which was, how is it different from other diagnoses? So most people assume that because muscle weakness is really common in multiple sclerosis, that if you just strengthen the muscles, you'll get better, you'll get stronger, you'll be able to walk better. But that's not the case. That would work if you had true muscular weakness in the sense of an orthopedic sense. But when you have MS, the reason that you have muscle weakness and poor balance and potentially difficulty walking, difficulty moving throughout your day is not because the muscle isn't working, or it's not because the muscle's not strong enough. It's because the neural pathway isn't strong enough. So there's strategies you need to implement to strengthen the neural pathway and the muscle versus just the muscle, which is why when you have MS, if you're doing generic traditional exercises, maybe at home or even at the gym or even with physical therapy, you might notice improved strength, but no improvement in function. So you feel stronger, but your walking is not any better, or your standing up off of a squishy surface like a couch isn't any easier. So we really have to focus on strengthening the neural pathway and then the muscle versus just the muscle.
Dr. Gretchen, I want to ask, is MS, is there similarities to like Parkinson's in some aspects?
There are similarities.
Yeah. Is there, I was just, what would you say is this most similar disease or, pathological issue that you would compare MS to? I'm just thinking Parkinson's in my head, but I don't have the experience that you have. Is there one that you would call out?
Yeah. So when it comes to other neurological and neuromuscular diseases, The one that I would say would be most common would probably be Parkinson's in the way that it presents physically. Because with Parkinson's, one thing that can be present is this rigidity, hesitation, and that can be present in multiple sclerosis as well for some people, not for others. But in the sense of just visually picturing someone with Parkinson's and someone with multiple sclerosis, it might be challenging to tell what they have because the walking characteristics can be so similar. Also, anyone diagnosed with ataxia, so difficulty and uncoordinated walking, might also present as having multiple sclerosis, but you can have ataxia and not have MS. And then another common one is transverse myelitis. So, this is also a neuromuscular disease, also demyelinating disease that can present similarly, but it's different in nature.
What do you find for your patients and the people that seek you out? And we'll get into, the services that you offer here shortly. What do you find for them is the hardest part? Because I'm just thinking of, people I know that have had MS or Parkinson's or ALS, stroke survivors. Yeah. And one of the, at least in their opinion, one of the hardest parts for them though was the mental aspect. And you kind of touched on this a few minutes ago, where they want to do it, they feel like they can do it, but their body's not allowing them to do it. What would you say are some of the biggest hurdles or difficulties for people with MS?
I would agree with that. I would say the mental aspect for sure. And I think that's highly correlated to one of the most common symptoms of MS, which is fatigue. 80 to 90% of people with MS suffer from fatigue, but the fatigue that they suffer from feels very different from the fatigue that you or I might feel. We would feel fatigued after a workout or if we didn't get enough sleep, but fatigue in MS for some people can feel debilitating. Opening your eyes can even feel like too much of a task because your eyelids feel so heavy or your legs feel so heavy that you can't move, you can't get them out of bed or walk forward. So it can be really debilitating. And obviously there's different levels of severity, but fatigue being one of the biggest symptoms, often when we're fatigued, we think, well, I'm just not going to do anything. And in some cases, that is absolutely true. One thing that I say to do when you're fatigued is to rest guilt-free. So often when we rest, we feel guilty about it, and that then it doesn't feel as restful. So resting guilt-free is absolutely an option. But I think another barrier that people have is that they don't know what to do when they are feeling fatigued and when they are feeling like, well, this isn't going to do anything. And research shows that exercising in small doses throughout the day, just here and there, is just as effective as exercising all at once. And that exercise, low to moderate exercise, actually can improve fatigue. And so educating on what can you do from bed? If you're having a day that you are just in bed all day, what are some very light movements that you can do that might be able to help your energy? Or exercises from your couch, or even from the toilet? Like, what positions are you in throughout the day that we could maybe get a little bit of movement in to help you? So fatigue would be a big, big barrier. But as you mentioned, the mental aspect too, which I think is twofold. Partially, it's believing that you actually can improve, because when you have a progressive chronic disease, it can be very easy to feel like, well, I'm done. This is just going to progress no matter what. This isn't going to help. I'm not going to exercise. But so much research shows that exercise can slow the progression of multiple sclerosis, and it can actually improve your strength, your walking, your balance, etc. So believing in that, understanding neuroplasticity, I think can help you do something even on the days where you feel like you want to give up and you just don't want to participate.
Right. And how about for people who are listening or watching who either themselves or have loved ones that have MS, and maybe they're going to physical therapy once, twice, 3 times a week, whatever it may be. Mm-hmm. Do you feel like they would be better served going to a physical therapist specializing in MS, or do you feel like they would be getting essentially what they would need at their physical therapy?
It depends on your physical therapist because there are some physical therapists that are not MS specialists, but they've done the work themselves to educate themselves on neuroplasticity and functional exercise. So if they know the answers to that, like if you were to say, hey doc, what's neuroplasticity? Can you explain that to me? And they're able to explain it to you, they're probably a good PT to be seeing. But if they're kind of stumbling over their words, if they're not exactly sure what it is or how it relates to MS, that might be a sign that they're probably not the best person to be working with you. Another big thing is if you feel like you're either not making any improvements at all, or you are making some improvements, but it's not translating to your goals. Like you have a goal of getting dressed without falling over, and that is no better. You're not making any progress towards that. Or you want to be able to walk throughout your home without touching the walls and touching the furniture, and you're not making any progress towards that. Think about your day-to-day life. And if you're not making progress towards those things, probably not the best PT for you to see. They're probably treating you with orthopedic exercises versus neuroplasticity based exercises. So you might be seeing a good one, but those are some things to be on the lookout for because it is very important that you do see someone who knows about MS, who knows about neuroplasticity and functional exercise. It'll make or break the situation. And most people that I see, especially on the very first visit, they might even say something like, I'm only here because my neurologist told me to come get PT, but I've tried it before. It didn't help. So I don't know, tell me what to do. And they're feeling already defeated and like, yeah, like this is just going to be the same thing they've tried before, but it should be different. It should not be the same as orthopedic PT, which is where most people go for things like strengthening and walking.
And, I want to follow up a couple of questions here. So, we've said MS, we've said multiple sclerosis. For people who they know that name and they have a general idea, explain what multiple sclerosis really means.
Multiple sclerosis, technically, what it means is sclerosis means scars. So it means multiple scars. And to take that a step further, what that means is you have scars somewhere in your central nervous system, which means on your brain, your spinal cord, or optic nerve. And so when you have MS, it's an autoimmune disease. So your body essentially kind of attacks itself in a way. And when that happens, inflammation occurs. And when there's inflammation, these scars and demyelination can occur because in MS specifically, the inflammation causes the myelin to disintegrate. And if you don't know what myelin is, it's kind of like a nice cushiony pillow around our nerves. And when we have nice cushiony pillows around our nerves, it allows our muscles to work the way we want them to work. We can move them fast, we can move them well. But when that myelin is thinner and maybe it's gone in a few places, our muscles don't work the same or maybe even at all. And so we really need to be able to work on the nerves. That's why I keep saying we have to strengthen those neural pathways, meaning the pathways from our brain all the way down to every muscle we have in our body.
Thank you. Now, the follow up with that, what are things that usually present themselves as, I need to get checked to see if I have MS? Are there warning signs, triggers? Is there a demographic that is more susceptible?
Yeah, so women are 2 to 3 times more likely than men to get multiple sclerosis. Common age of diagnosis, which is pretty broad, but 20 to 50 years old. With that said, of course, there's pediatric MS where you're diagnosed before the age of 16. I've worked with lots of people who were diagnosed at the age of 60 or 65, but generally speaking, between the ages of 20 and 50 is when most diagnoses happen. When it comes to symptoms and things to be on the lookout for, it's always, I think, a touchy topic because so many of the things I'm about to mention are things that can happen for other reasons. So often when I share what I'm about to share, everyone is like, oh my gosh, I need to go get checked because there's so many things that are really common. For example, one of the very common first symptoms might be spasticity or more so numbness, tingling, pins and needles in one leg. And that can sometimes happen from sciatica. And sciatica is super common. It can happen from back issues, from slipped discs, from muscles being too tight. And so we're more likely to chalk that up to something else. So we don't actually go get that looked at. But that could be one common symptom. Or weakness in one leg versus both legs is also a common first symptom. One of the most common reported symptoms that happens initially is vision changes. So double vision, blurred vision, any loss of vision in one or both eyes. But the reason that people think that that is so commonly reported as the first symptom is because we usually don't mess around with our eyes. If something's wrong with our eyes, we're going to go to the doctor. But if it's numbness in our leg, that might be due to the way that we sat or because we over-exercised, we're less likely to get it checked out. But the weakness, the sensory changes, vision, those are some of the biggest ones first. Foot drop, where you're scuffing your foot more often, you might be tripping a little bit more often, is another common one.
Interesting. Is there any correlation to any cognitive decline with MS? And I'm thinking Parkinson's again, of course, in my head. Is there that relation with MS or no?
There is, and it's anywhere. I just looked up this number recently. I believe it's about 30 to 40% of people with MS can have some type of cognitive impact. And it could be things like forgetting words or forgetting sentences. It's not typically the same as like Alzheimer's, where you just forget memories. Usually it's in very specific situations, or someone was recently telling me that they forgot to turn the stove off. So you're just multitasking and it's easier to forget certain things in the moment. So that can be common. I don't see that personally in the almost 9 years I've been an MS specialist. I haven't seen that too often, but it can be a common symptom, again, about 30 to 40%.
Okay. Thank you. Last question about this is there preventative measures that people can take to maybe reduce their risk of developing MS?
So we don't know exactly what the cause of multiple sclerosis is, which makes taking preventative measures a little bit more challenging. But there are a group of things that researchers think lead to multiple sclerosis. And one of those things is living further away from the equator due to the low vitamin D levels. So potentially making sure we're getting lots of vitamin D. Of course, smoking, obesity, high BMI, those things aren't going to be good either. Living around industrial toxins has been correlated to potentially be a cause of MS. Most recently, though, there was a study that showed that the Epstein-Barr virus, or EBV, or what most of us know as mono, could be one of the causes of MS. And it was really interesting because this study showed that, and I think they had like 10,000 people in this study. It was a lot, and they followed them for 10 years. And what they found was that every person who had multiple sclerosis also had antibodies for the Epstein-Barr virus, meaning they had EBV or mono at some point in their life, whether they were symptomatic or not. And a lot of people who get mono are asymptomatic. And so if you were told, oh, you have MS, you probably have had mono at some point, so many people would say, no, I haven't. I never felt anything, but you might actually have the antibodies for it. So that was an interesting correlation. And because of that, there's a lot of research happening now to look for drugs that are anti-EBV that you could take proactively. So if you know that you had the Epstein-Barr virus, you could take this and hopefully ward off illnesses like multiple sclerosis.
Well, in mono, they call it the kissing disease, and it's like highly prevalent in college age individuals. But I had never heard that fact before. I'm going to read about that later. That's really fascinating. So I want to move on here to your social media channels and all the great things you guys are doing. Something you share often on your social media channels are functional exercises. Explain exactly what those are and why those are so important. And I know you've mentioned some of the exercises, but explain that, because you accompany those with videos of you demonstrating them, and we'll have some up here on the screen for our viewers.
Yeah, absolutely. So, one thing to know about functional exercise is that it all stems from a goal that you have. So, one goal that a lot of clients that I work with have is they want to improve their walking in some way, shape, or form. It might mean tripping less, it might mean using a lesser mobility aid or not putting as much weight through their mobility aid. It might mean walking faster, but either way, it's walking related. And so, what a lot of people will do for that is they'll just practice walking. But with functional exercise, and this is so important in MS, you need to break down that goal into as many individual movements as possible. So if you think about walking, the first thing that we need to do to successfully take a single step forward is we need to shift our body weight forward. If we don't do that, we're not going to be able to lift the back leg up. We'll fall backwards. So you need to be able to shift your body weight forward. Then you need to be able to bend your knee, then swoop your toes up, especially if you have foot drop. Then bring your knee up towards the ceiling. Then straighten your knee. Then put your heel down on the floor. And all while that was happening, you were standing on one leg. Even if you were using a mobility aid, you still had to stand on one leg as that other leg moved forward. And so functional exercise means taking each of those steps. That was 7 steps. And each of those 7 steps are their own individual exercises. So, for example, one that I mentioned, the first one was shifting your weight forward. So you could practice shifting your body weight forward and then backward, forward and then backward. Another one that I mentioned was bending your knee. You could practice bending your knee as an exercise. And then we want to take it a step further and choose the most functional position. So when you're walking, you're standing. So the most functional position to exercise in and do these movements in would be a standing position. But if that's too challenging, you could always try it in a seated position or maybe lying down on your back or on your side. So we want to think about what exercises to do, but also what positions we should be in. And this is where orthopedic exercises really don't cut it because oftentimes they're not functional. If you think about physical therapy, so often people will say, oh, I did the clamshell exercise, the straight leg raise, the side lying leg raise. All of them are great exercises, but they're all lying down on a plinth table. And when you have MS, you don't have the same carryover. So you could get full strength in your muscles lying down on a plinth table, but you go to stand up and those muscles that you had lying down are just non-existent. They're just not working. So that's why it's important to choose a functional position as well as functional exercises.
Oh, thank you for sharing that. And now you started your own practice, correct?
I did, yes.
With sharing these MS specific exercises online. What prompted you to do that versus being in a facility setting or a private practice setting outside?
Right. So I became an MS specialist when I was working for one orthopedic physical therapy clinic. And then I moved to a different physical therapy clinic, also orthopedic, and started an MS program for that company as well. And one thing that I found consistently at both practices was that my patients were not coming consistently. And the reason for that, often there were very valid reasons. Their fatigue may have been way too high where it wouldn't have been safe for them to leave their home that day. Or they didn't have transportation, or the weather was too bad and they wouldn't have been safe to walk outside with their cane or rollator. Or another symptom was kicking in, vision maybe was kicking in, vision loss. So I was noticing that they weren't coming regularly enough, but the ones that could come consistently were reaping benefits from these functional exercises. And so I specifically remember asking my boss at one point, I was like, can I go to them? Like, if they live within a 30-minute radius, can I go to them? Like, can I call them? And at this time, telehealth physical therapy was not a thing. And so the immediate answer was no, that's not something that we can do. It's not covered by health insurance. No. And so I eventually just got sick of that answer. And I felt like there's got to be a way to help people who can't come to an MS specific physical therapy clinic. Because not only that, but at the time, I was 1 out of 4 physical therapist in the entire state of Massachusetts that was a specialist in multiple sclerosis, meaning I had a lot of patients who were coming from an hour away, sometimes 2 hours away, and it just wasn't feasible for them to come in. So that led me to think about this online program where I'm able to talk about exactly what you should be doing and demonstrate and exercise via videos of the best exercises that I was giving most of my patients with MS. Because as MS is different for everyone, there are certain muscle groups that MS tends to attack the most. And those were the exercises I was giving everyone because everyone needs to be doing them to ideally improve or at least ward off those muscles from being attacked.
That's fascinating. How long has the MSing Link in your practice been in business now?
Yeah, it's December will be 5 years, which is really exciting. And it was crazy because it was this idea that I thought of, but I didn't really know how interested people would be because physical therapy mostly is thought of as in person. And so, but I knew that people needed it because they couldn't get to me. They couldn't learn what they were learning in person. And so I started it kind of on a whim that I think this is needed, but fingers crossed, we'll see. And it just right from the beginning has grown and grown, which has been so cool to see that something that I thought was needed actually was. And it's filling this void in the MS community.
Is there anyone else doing something similar to what you're doing?
Not that I'm aware of. I do know that there's some personal trainers who work with people who have MS, but I don't know of any physical therapists that focus on this type of comprehensive program. Because another thing that is in my online programs, my business, is I bring in other MS experts to talk to my members. Because another thing with having MS is you might only get to talk to your neurologist once a year, at best twice a year. So I bring in MS neurologists to my program so that they can educate us on a topic. You can ask your questions. I bring in speech and language pathologists, pelvic floor physical therapists, dietitians. So these experts that my clients wouldn't otherwise have access to. So it is truly, it's exercise, of course, and physical therapy, but more comprehensive than just exercise.
Yeah. Who would Dr. Gretchen say is your biggest inspiration as far as in the field or, study or the specialty of MS? Who do you look up to?
One person I've always looked up to is one of my very first mentors she's a physical therapist and she's specialized in multiple sclerosis. And the reason why I always look up to her, and she's still working at an in-person PT clinic, but the reason I look up to her is because she had so much passion and belief and hope for all of her patients with MS. And so right from the get-go, I started feeling that way too. Like I was super hopeful and excited and motivated to work with each of my patients. And I find that to be so helpful for my patients too, because the more belief I have that they actually can improve, which is research backed, it's not just me being optimistic, the more positive they're feeling about it. So I've always looked up to her personality, but also she's just such a go-getter. She's always staying up to date on research. And so therefore I do too. So she's been a really great mentor along the way.
And she's still in practice?
She is, yep. And she is in Rhode Island, unless she's moved since we last spoke, but I think she's in Rhode Island.
Has she taken part in any of the MSing Link online courses?
She was one of our guest speakers at one point.
That's great. That's great. So, just a minute ago, you were talking about routine. How can individuals stay on a consistent routine for the long haul versus continuously, falling off the tracks? And I think that could be said for any patient in any situation, but specifically for MS, and I was so happy to hear you say this, dealing with the families that we take care of, one of the biggest issues is always transportation, so we're there, we're providing the help with all their IADLs and their ADLs and all of their other needs in between. But like, if we weren't there, they wouldn't be able to go to that physical therapy appointment or that neurologist checkup. How can these families get in and stay on a routine?
Yeah, I think this is so important. And it also comes into play too when some common thoughts that pop into our minds, especially when you are at a physical ability level that is less than what you used to be able to do, certain exercises that you do might feel like, my patients tell me this all the time, they might have the thought of, what is this going to do for me? Like, really, you want me to lift my leg as an exercise? I used to run marathons. And so it's easy to like degrade like what you're currently doing and feel like, well, this isn't going to do anything. And that's not going to help with consistency either. But one thing that I have found works really well for my patients and their family members is to come up with a really strong reason of why this is important to you. And I take them through an exercise, which is, I call it the why exercise, which just means ask them why over and over and over again until you get to a deep meaning. So, for example, I was talking to one of my patients a little bit ago, and I asked her, what is her goal? And usually people say something pretty broad, like, I want to walk better, or I want to get stronger. In this case, she said, I want to walk better. And I said, why do you want to walk better? And she said, I want to walk better because then I can move around easier and I won't be as fatigued. And I said, why do you want to move around easier and not be as fatigued? And she said, because if I could move around easier, I might go outside more. I said, why do you want to go outside more? She said, if I could go outside more, I could get more exercise and, just move around outdoors, get that energy. And again, I was like, why? And we just kept going. And then eventually at the very end, when I asked her why she wanted to do something, her answer was, because then I could take my son trick-or-treating. And that to me is like, okay, that's it. Like, we want to get to a point where it maybe includes other family members, or it's a deep meaning. Like, it makes you even a little emotional to think about it. Because then now when this person is lifting her leg as an exercise, instead of thinking, this isn't going to do anything, what is this? She's now thinking, I'm lifting my leg in this exercise so that I can take my son trick-or-treating. And in this specific case, she was a single mom. She wanted to be able to offer her son those types of experiences, even with her mobility limitations. And so it was really powerful for her. So that's what I recommend for everyone to do, is start off with your basic goal, but then why is that important? And then whatever your answer is, why is that important? And try really hard to ask yourself why at least 5 times. It might be really challenging to come up with something at first, but usually people are able to come up with something that does provoke some emotion.
Sure. Well, and as you're saying that, I'm thinking of furniture from Ikea, right? The final assembled product looks beautiful, it looks great, but when you get that box, you have the instructions. There's bags and bags of little tiny things. I'm not the person that would be putting it together, admittedly. But, I look at it and I'm like, why do you need all this? Like, it should be a lot simpler, but the end product is what your goal is, right? You got all these pieces, and it's, there's some similarities there, and I can relate to that. Well, why do I have to lift my leg? Well, that's the bag of parts and pieces. The end goal is so you can take your son trick-or-treating. It may not make sense right here and now, but all of these things assembled together will create that beautiful outcome that you're reaching for. Now, you've also written a book, and I think it might be behind your left shoulder. We'll have a picture of the book cover up here on the screen. But in the book, you talk about different types of exercises and why focusing on several types is important based on the goals that you have. Share more about why that's so important.
Yes. So the reason that's important is because as a physical therapist, one thing I hear all the time is, I don't know why I'm not XYZ. I'm exercising. And I'm exercising consistently even, and I'm not feeling that way. So an example might be, I don't know why I'm not walking faster. I exercise daily, or I'm exercising consistently, or I don't know why I can't walk further distances. I'm exercising consistently. And the thing is, what tends to happen is we tend to group exercise in one thing, but there's so many different types of exercises, and you have to exercise directly in correlation to what your goals are. So for example, if you have a goal of potentially improving your walking, let's just say, and specifically your walking speed, you have to do speed-based exercises. Otherwise, your speed probably won't improve. If you want to improve your strength, you have to do strengthening exercises. If you want to improve your balance, you have to do balance exercises. If you want to improve your endurance, you have to do endurance-based exercises. And they're all slightly different. There is a little bit of overlap. So I never want anyone to get the impression of, oh my gosh, I'm going to be exercising for 5 hours a day because I have all of those goals. But generally speaking, you want to think about your goals in a very specific way. What about walking is your goal? And correlate specific exercises for that, because speed is a very specific goal. And if you're not working on speed, it won't improve. And you might be working tirelessly on your exercises to try to get as strong as possible, and your speed's not still improving, and you're getting even more discouraged. And so often that discouragement and that sense of defeatment can be relieved by knowing that you're doing the right type of exercises for your goals. So thinking, same with flexibility. People will say, my muscles are so tight, but I'm exercising consistently. And I'll ask them, well, what exercises are you doing? And every single one is a strengthening exercise. Like, okay, well, strengthening doesn't translate to stretching. We have to incorporate stretching too. So I just found that too many people didn't know that. They weren't aware that that was a thing and that they needed to be looking for this in their exercise routine to make sure it was well-rounded.
So that, I guess I would go back to my question I asked you earlier, is where are they getting that information to do those exercises then? Is that coming from a physical therapist who may not be as well versed in MS, or are they just going online and looking for exercises? A little bit of all of it?
I think it's a little bit of all of it. And I think part of it too just stems from when we're younger in gym class, and maybe even if we're part of sports, we're never educated on this. We're just always educated on, okay, exercise equals running. Exercise means jumping jacks. Exercise is whatever we've done in gym class or with a sports team. And so the person who should know about this and should inform you about it should be a physical therapist, maybe even a personal trainer. But unfortunately, it's just not discussed enough. I have a full chapter in my book on this for that reason, because it's just not talked about. And if you don't know that it exists, you're not going to change how you're exercising. And you might truly believe you might truly believe and think that you are doing everything in your possibility to improve towards your goal, and it's not happening. And it's just because of this very simple thing that you could correct on your own.
Yeah. And you also have a podcast, correct?
I do, yes.
Is the podcast called The MSing Link as well?
Yes.
We'll have that up on the screen. And what do you typically talk about on The MSing Link? Do you usually talk about tips, or is it just a little bit of everything?
It's a little bit of everything. Every other episode is an episode where I am giving tips and tricks and strategies on how to feel your most confident with MS, whether that's through exercise or a mindset trick. And then every other episode where it's not me, I am interviewing someone who can educate people with MS, as well as other neurological diseases and disorders, on something that can help them. So it might be a helpful product or tool. It might be an MS neurologist that can share research that's happening, or a researcher sharing what they're working on. And so again, I try to have everything that I do be very well-rounded, not just focused on one area, because I'm so aware that people with MS and other neurological disorders don't have those resources, especially not in one place.
Right. I want to talk to Dr. Gretchen, and thank you again for your time today. I want to talk about mobility aids and assistive tools around the house. I feel sometimes they're a positive, but they can also sometimes be a negative if they're not used correctly. Or we have found where some people use them almost as a crutch, and they don't want to push themselves or try to improve their mobility for fear or a lack of understanding of their illness. What are your thoughts on those?
I am a huge fan of mobility aids. I think a lot of people, as you just touched on, they maybe due to a stigma, they don't want to use one, even if they should be using one. And so I think partially we need to get over that stigma of whatever it might be, whether it's I feel old if I'm using a mobility aid. There's so many mobility aids now that are not the typical nursing home style metal walker or cane or anything like that. But using one when you need it is the first step. But what I find happens a lot is once people say, okay, I'm going to use one, I'm okay with this now, I'm going to move forward with it, we tend to, as you said, use it as a crutch. We tend to use it too much. And a perfect example of this is actually my dad, who does not have MS, but about a year and a half ago, he had toe surgery. And his surgeon said, okay, you cannot put any weight through your toe for 2 weeks. And my dad is a super active guy, so this was killing him. But because I'm a physical therapist, I have walkers, I've got canes, I got lots of stuff. So I brought him a rollator, which is a walker that has 4 wheels. And I just put it in front of him. I didn't give him any directions. I just said, here you go. This is what you can use. And my dad is someone who generally is very good posture. You know, he holds himself well. As soon as I gave him a rollator, I should have wished this was on video. He immediately collapsed. His shoulders sunk in, he fell down, his was super curved, poor posture. And I just looked at him. I was like, why'd you do that? And he didn't even know what I was talking about. He's like, what do you mean? I said, fix your posture, stand up taller. And it just goes to show that when we have something in front of us, when we have something that we can use, for some reason, our minds and our bodies just say, oh, okay, I'm going to put all of my weight through this item, through this product. And that is not a good thing, because the more we heavily use mobility aids, the more we're going to become dependent on them. And dependency is not always something that is required. We might only need a mobility aid on the days that we're feeling fatigued or if we're going outside. But the more you're depending on it unnecessarily, the more likely you're going to need it for the long haul, because you're training your brain that you need it. So just becoming aware of, how much do I need to use this mobility aid? Do I need to put all of my weight through, or can I take some weight off and move forward from there?
How's your dad now?
He's good. He's fully healed.
Good. Just a couple more questions. And again, thank you for your time. What's your favorite type of video to make?
Ooh, I love exercise videos where I'm demonstrating and explaining why it's important. Because I'm the type of person where if I don't understand why I'm doing something, especially if it's a movement that seems silly, I keep mentioning the same one, but just like lifting my leg. If I don't know why that's important, I'm personally not going to stay consistent with it. So I love demonstrating like how-to videos of how to do something and why that's important. What muscles are weak? Why is that happening?
Okay, great answer. And I asked this of a lot of our guests, especially ones that we've become friends with. If we ran into each other 5 years from now, and I said, oh, Dr. Gretchen, how's it going? How is it going with the MSing Link 5 years from now?
Oh my gosh, I imagine that the growth that we will see in 5 years is just going to be exponential in terms of how many people we're impacting. Even at 5 years in my online program, I have helped, I believe the number right now is about 740 individuals with MS that live in 25 different countries. And I just think that's just going to continue spreading. I'll probably have at least one more book, because I just got so much joy out of creating it, just another resource that people can help learn from. So the growth, I think, in that short time, 5 years isn't too long, but with online programs and resources, the growth is just, just from YouTube, you can reach so many more people.
Absolutely. And my last question, give us your most positive interaction or rewarding, I guess I should say, experience with one of your patients, and one that you might look back at and have regrets or just feel like you weren't able to help them as much as you knew you could have, or it was more difficult. Give us those two examples.
So for the one where I would kind of look back on and regret, wish I could have helped a little bit more, was early on. This was before I was an MS specialist. And it was one of my newer patients with MS who was a little bit further progressed than the first two patients that I initially mentioned earlier. And this person was more so presenting almost stroke-like versus just classic MS. And at the time, I didn't have much knowledge on it. So I only really felt confident with classic MS. And so we were doing some exercises probably a little bit more focused on the orthopedic side, but she had a lot of spasticity and stiffness. And I just didn't know ways to help with that specific symptom. And so she did notice some improvements, but we kind of just ended on, she was at this plateau. We couldn't really push past it. And knowing what I know now, for spasticity and for mobility, there's so many things that we could have tried that we didn't even touch on. So I think about that pretty frequently. For one that was super rewarding, I was working with one of my female patients, and she was starting off at a point where her biggest goal was to walk on uneven surfaces, specifically because her daughter was getting married. And she was getting married on the beach. So she had to be able to walk confidently on sand. And at the time, she was nowhere near that. And so, long story short, she was making a good amount of progress, but then she got the flu. And when you have MS, the flu or a cold or a UTI, anything like that can really throw a wrench in how well you are doing. And it brought her back to basically square one. She lost all of the progress that she was making, but I was educating her on just doing what she can, even if it's a fraction of what she was doing before. And so over the next 3 months, she was able to gain back everything that she had lost. And then we continued improving. And then she was actually able to walk on the sand confidently at that wedding. And that was one of the very first times where I've seen someone go through that full transition of improving, regressing because something happened, improving again, and meeting her goal. I'm getting the chills right now as I think about it. So she was the very first one that saw something transformational like that. And so I always think back to her. And since then, there's been plenty more. But that one I think means the most because it was the first one.
And that's why you do what you do, right?
It is, yes.
This isn't real. Well, I guess this is the last question, even though I said that was. Where would you like viewers and listeners to find you at to learn more? And we'll have all of this in the show notes as well. But why don't you tell them where they can find you at?
Absolutely. So it kind of depends on what platform you prefer the most. So I have a YouTube channel. Yeah, I got a YouTube channel, Dr. Gretchen Hawley. Instagram is dr.gretchen. I have a Facebook group where I post lots of content. I have a TikTok and Twitter and LinkedIn. All of it is either Dr. Gretchen or Dr. Gretchen Hawley. And if you're interested in working with me or just seeing what I have to offer, my website is MSingLink.com. And the book and podcast are also called The MSing Link.
And that's MS.
Yes, MSing Link.
All right. Well, Dr. Gretchen Hawley, thank you so much for all that you're doing. And it's just wonderful to see how many families you're touching and helping who are struggling with MS. And we appreciate your time today.
Of course. Thank you so much for having me.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Dr. Gretchen Hawley for joining us today. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.